Good afternoon to all the participants. I am Professor Dr. Virender Chaudhary, Principal SN College of Nursing Sri Ganganagar. Welcome you all on the first national virtual conference that was focused on the qualitative research. Shortly, our expert will join us. And as we all of know that research is in a golden key for the success in the present scenario. And our all the experts will going to be discuss about the importance of qualitative research, its role in the nursing field, medical field, and the other allied health sciences. And I hope that experts view will help you, all of you, to gain the knowledge, and that same knowledge can be implemented in the care of the patient as well as welfare of the nursing profession. Thank you very much. And shortly we will be again live with the presence of our speakers. Thank you.
अभी अभी नहीं c'è Ivara che Ivara che Ivara che Ivara che Ivara che Ivara आया
Participants are requested to kindly mute themselves.
इसको
And Madam,
इसके ऊपर रखना है ना
kindly mute yourself. All the participants are requested to mute themselves.
यार क्या कर रही है डोंट वॉच कैसे करेंगे तो बताओ स्वप्निल रहानी हाँ जी स्वप्निल रहानी कौन तो है यार जितना फाउंडेशन में मेंबर है शायद वो जियो लग रहा है अच्छा लगी तो मस्त हमें देखो इंस्टा मम्मी इंस्टा पे नहीं है ना हमको तो बहुत कुछ पता चलता है oh no यही है मैंने इसे ही जाना है बैंडेड से भी 10 लेफ्ट
Good morning, everyone. Today we are going to organize one virtual conference on quantitative research methodology. So, first of all, I would like to thanks our director, sir, Dr. S.L. Sihag, sir, Mr. Vikas Sihag, sir, our principal, sir, Dr. Virender Chaudhary, and our speakers. Uh, First of all, as scheduled, uh, today's speaker is Mrs. Sakshi Chaturvedi, who is Associate Professor at Vanastali Vidyapit, uh, Nursing College at Vanastali, Rajasthan. And as scheduled on tomorrow, 28th of July 2023, next speaker is Dr. Anu Gaba, who is a professor at MIT College of Nursing, MIT University, Gurgaon. On next third day, our speaker is Dr. Kavita, Professor, Meenakshi Academy of Higher Education and Research, Chennai, Tamil Nadu. So once again, a special thanks to our director sir, our principal sir, and now we are going to start our conference.
Very good afternoon to one and all who are present on this virtual mode to attend this first national virtual conference that is directly focused on the qualitative research methodologies. And it's immense pleasure for me to be in front of you, as we know that nothing will be possible without the support of the members of
सर
a
वॉल्यूम बहुत स्लो है
dedicated teams.
वॉल्यूम प्रॉब्लम आ रही है सर
Okay, sir, we will see it. Now it's okay, sir. Is it voice is audible?
Yes, sir.
सर
Okay, thank you. So it's an immense pleasure for me to be with you today in the occasion of this first national virtual conference going to be organized by the SN College of Nursing, Sri Ganganagar, Rajasthan. As a member of this organizing committee, I welcome you all who have joined us all around the world. We have seen so many of our foreign participants who are joining us through this virtual mode. And I'm really thankful to all of our eminent speakers who have given their valuable time, as well as I'm thankful to all our participants because nothing will be successful without the presence of the dedicated participants. Because all of you have taken their busy schedule to join us, I am also highly grateful to the management of the SN College of Nursing. SN College of Nursing, it was established in the year of 99, and it is a grateful for me to share this little bit information about our college, that this is the first private sector college who have started with the vision of imparting the nursing education in the minority areas of Rajasthan. As we know that, I think in some of who are from outside of Rajasthan, actually Ganganagar, it is a border area of India and Pakistan, and where the education was a very back door. So in this, our visionary chairperson, Dr. SN, the College of Nursing to impart this knowledge. So the quality of nursing care in the year of 2006, the BSc nursing program was established under the chairmanship of Dr. SN Sihag and our worthy director, a visionary director, a young leader, a enthusiastic person who are dedicated for the quality of education. And with this, Dr. Vikas Sihag, excuse me, Neetu madam, please kindly mute yourself. Dr. Vikas Sihag, he is a visionary director, a young leader, and who are focused for providing of quality of not only the nursing care as well providing the medical care for the region of Ganganagar. And with that, the college has again started their PG program in the year of 2012 with the all five specialties in the nursing field. And 2018, we have established our 200 bedded on parental hospital in the name of SN Super Specialty Hospital. And this was the vision. And on that vision and objectives, the entire team of the College of Nursing will be delivering the quality of education. And this was a one step that we have taken forward to start this virtual conference with the help of the dedicated eminent speakers from the various institutions for all our around the states of India. And I'm really thankful again, and this is my heartful thanks to my all the eminent speakers that with the one request they have ready to share their knowledge and impart their knowledge to the fraternity, nursing fraternity. And with these words, I would just take 5 minutes from your side to just have a look on this PPT presentations of the SN College of Nursing. Bandi ji, kindly share the PPTs of the college. कोई बात नहीं, आप इसको बड़ा कर दो. Right. Next. They are our pattern under the leadership of Dr. M.S. Nirvan and Dr. S.L. Siag and our new young leader, Mr. Vikas Siag. This college was achieving the height of the profession. Next. The College of Nursing is offered the 4 programs: BSc Nursing, MSc Nursing in all 5 specialties, post-basic BSc Nursing, and GNM programs. This is our own parental hospital with a 200 bedded. There we are providing all the medical facilities under the single roof. So it was the first and the single hospital in this region who were imparting that with the 200 bedded. This is our another established hospital parental, that is the Siag Hospital, the 50 bed intakes. Next. So this is the physical infrastructures of our college. We have a separate hostels facility for our girls and boys. We have a well spacious smart classrooms. We have a sitting of good library with the latest additions. Well equipped nursing labs for imparting the knowledge for our students. The college is not only focused in the educational activity, it is also focused on the extracurricular activities for their students. For that, we have organizing the sports every year for our students. We are also dedicated to serve the society, and on view of that, we have organizing the various events in the social, in the community areas, and the newspaper is also given a space for the College of Nursing for its social activities. So this is the responsibility that college is having towards the society also. And regularly we are following these events by participating and organizing the different social activities for that. Thank you very much. And with these words, I will request to our today's eminent speaker, Madam Sakshi Chaturvedi. She is the associate professor of one of the renowned university of India, that is the Banistali Vidyapeeth. And this is the university that with the A plus grading since its establishment. And thank you very much, madam, that you have joined us. And with the one invitation, you have given your consent to be a speaker for our conference. Thank you very much, ma'am. Sakshi, ma'am.
Yes, sir. So, good afternoon to one and all present here. Myself, Sakshi Chaturvedi, and I'm working as Associate Professor in Vanistali Vidyapeeth, Faculty of Nursing, Rajasthan. And today I'm really thankful to Dr. Virendra sir and SN College of Nursing Organizing Committee member for sharing this wonderful opportunity with me. And as per topic, today we'll be talking about introduction of qualitative research. May I ask organizers to share PPT, or shall I share, sir?
You can share or just we are trying some technical issue was there. We are just going to be share within. Just wait for a few minutes, ma'am.
Okay, sir.
अगर अपनी कोई बात कर देना इशू
Slideshow mode, sir.
Yes, ma'am.
Thank you. So, as we all know, my voice is audible, sir.
Yeah, ma'am. Very strongly, ma'am.
Yeah, thank you, sir. So, as we all know, when we are talking about qualitative research, it is beyond the numbers. That means we are not talking about numbers here as we are talking in quantitative research. We will talk about quality here. So, it is beyond number, exploring the human experiences in nursing research. That is the title which we can give to qualitative research. Let's start with introduction and types. Qualitative research can be understood as exploring complex phenomena. Complex phenomena can be our personality or anything. It can be patient experience, it can be any event. So, basically, to explore any complex phenomena such as patient experience in a way that quantitative cannot do, but qualitative can give us some idea about that experience. In this, we will use open-ended question and allow participants to share their stories. It can be their story, their feelings, their attitude, anything. So they will share their stories, and by hearing their stories, we will gain their rich insight, and we will develop perspective. We will understand their emotion, and this information can then be used to improve patient care and outcomes. Let's define qualitative research. Qualitative research is a method of inquiry that explores social phenomena through open-ended question, observation, and interviews. The aim of qualitative research is to find the meaning behind the human behavior, any human experience, or interaction. In nursing research, qualitative research helps us to explore the patient experience, healthcare provider perspectives means what they should do when they are in particular health setting, that is their perspective, what they will do, and cultural factor that can influence the health outcome, because we are working for health outcome betterment. So we have to see what we can do for better health outcome. That's why we can use qualitative research there. Next slide, please. One example is shared here. A qualitative study may be conducted. Everyone has heard we used to conduct qualitative research when some event has happened. So, a qualitative study may be conducted to explore the experience of cancer patients who are undergoing chemotherapy. The researcher may use interviews to collect data because information is highly needed. So, interview will be collected on the patient's emotions, their physical symptom, their coping mechanism, what method they are using to cope up with this particular situation. This information will provide us insights into how healthcare provider can improve the quality of care for cancer patient. Next slide, please. Next slide, please. Back slide, sir. Yes, back. Now we'll understand what are the characteristics of qualitative research. Means what are the important points that we will find in every qualitative research which differentiate it from quantitative research. First important point is, next slide, subjective and interpretative. All the qualitative research, they are basically subjective. Subjective means there will be collection of data through the subjects. Who are the subjects here? All the participants, they are subject here, and nobody else will collect data on the behalf of researcher. Researcher itself will go to the participant, they will collect data, they will conduct interview, and they will interpret the information which is shared as experience by the subject. So it is subjective and interpretative. Next slide, please. Every qualitative research will be contextual and naturalistic. Whenever we are conducting qualitative research, we should be very much clear there will be some context behind the research. For example, we may explore behavior, we may explore attitude, or any qualitative researcher may explore belief regarding a particular event, a particular situation. So it will be always contextual, and it will be in naturalistic setting. No laboratory, no experiment will be created. It will not be like quantitative. It will be as much as natural as we are talking with another patient or another person in a private room. It can be. So it will be highly natural, so that any person can share their experience without any fear, and we can dive into that experience and can gain some insights. Next slide, please. Next slide, please. Qualitative research will be inductive and emergent. When we are saying inductive, that means we will induce the thoughts, right? The induction of thought will be done by experience which are shared by our patient, our clients, our subjects. So whenever we'll conduct interview in qualitative research, there will be induction of a feeling which will help us in understanding the future of or perspective of that particular problem. Say a person is saying, I am feeling so and so in a particular situation. We as a researcher actually, so it is inductive, it is not deductive. We are not knowing anything about the experience previously. Our client, our patient, or our subject will let us know that this particular feeling was there, and qualitative research will be considered as inductive there. So it will lead to development of new thoughts there. That's why it is very much important. And it is emergent. Whenever something is inductive, it is arousing 100%, it is useful for many fields. So it is considered as emergent here. It can be useful in psychology field, it can be useful in any organizational data management or anything. So it will be inductive and emergent. Next slide, please. Qualitative research will be detailed and descriptive. As already we have understood, there will be conduction of interview. So, and interview will be subjective, right? We will ask question in an open-ended form. So it may last up to 25 minutes, 30 minutes, 35 minutes, depend upon the question and depend upon the title of the study. So the important thing is we will gain a vast experience, detailed experience, who is doing, why they are feeling so, what actually they have felt, how they have how they have come into this particular situation, how they are overcoming these particular feelings, what are their mechanism for defense. So a detailed and descriptive knowledge will come after conduction of interview or after analysis in qualitative research. So deep understanding will be there regarding any event. This deep understanding can be conducted. Usually we are conducting interview, But say we can have some videos, we can have some audio recording, we can write also while conducting qualitative research. So a single thing, say we are having pain, this pain will be explained by the patient through the journey from where he has entered and till the discharge, how he has felt that particular pain in a meticulous way. That means pain was intense, pain was moderate, pain was severe, nobody was able to manage that pain, then particular another doctor came, he gave this particular therapy. That means on single word pain, a number of dialogues will be shared and many themes will come out and meticulous data will come to us when we will hear that particular recording again and again. Next slide, please. Qualitative research is reflexive and ethical. Whenever a researcher is qualitative researcher, they are actually reflexive practitioner. Whatever they are knowing, they know their bias. Say we are collecting interview in a qualitative research, but we know we cannot impose our thoughts. We cannot write what we are feeling. We have to write what our clients are saying. We have to correct ourselves. We are the instrument itself, so we are reflexive practitioner, and all the ethics which we are writing in our code of ethics for research proposal we are writing, that we will follow by our own, because nobody is going to collect data for us. We are tool itself and we are only collecting data. So ethics issue that we have to solve, how we will write the data, that we have to think. So everything, that means we are reflexive practitioner when we are a qualitative researcher. Next slide, please. Now let's understand most important types of qualitative research. The first important type of qualitative research is phenomenology. As the name is suggesting, phenomena. Phenomena means any function, any event, or anything which is happening, right? Which is causing something in environment, which is changing that particular environment. That environment can be inside, that environment can be outside. So phenomenology is concerned with the understanding of the meaning that people ascribe to their experience. जिसे लोग अपना experience बोलते हैं, उसी को ही हम qualitative research में phenomenology बोलते हैं. For example, a nurse researcher may use phenomenology to explore the experience of patient living with chronic pain. Say it is very easy to say a person is having chronic pain, but when we are a qualitative researcher, we can understand that this particular chronic pain is having many definition, is affecting many system, is related to many family members also, it is related to job pain also, many things are there, not only physical pain is there. So these particular thing which we are exploring during a particular event, during a particular phenomena, that particular things, that particular recording is known as phenomenology. Next slide, please. Second type of qualitative research is grounded theory. As the name is suggesting, it is grounded. That means all the data is grounded. We don't know what actually new theory is, what actually concept is. Whenever we will explore the previously conducted research, or whenever we will explore our patient, we will find that there are many themes, and on the basis of those themes, on the basis of those experience, now we will gain a concept. So the second type of grounded theory is qualitative research that aims to develop a theory. And when we can make theory, when already we are knowing something, but that something is grounded, that something is not known to public, that something is not known to any policy maker, or it is not known to our profession, but already it is done, but it was not experienced by, or it is not communicated by any researcher. So grounded theory is basically for development of a theory which is based on data collection from the research participant. In nursing and healthcare setting, grounded theory can be used to explore the experience of patient, caregiver, healthcare provider, and to develop a theory that explains the experiences. Next slide, please. Other type of qualitative research are ethnography. As the name indicates, it will deal with the ethnics, right? Tribes, culture, beliefs, it will deal with this type of exploration, to explore some tribe, to explore some culture. Ethnography will do. Then it is case study. We'll explore some unique cases, unique clinical presentation, unique social presentation. Historical analysis says we can analyze anything which has been happened in the past, but now we want to understand that. This is historical analysis. And there is content has been done, but we want to make it shortlisted, or we want to make it summarized for our audience or for our students so that they can understand it easily. So it is content analysis. Other types may be discussed by other uh, presenters. I will discuss with grounded theory and phenomenology here. Next slide, please. Let's discuss phenomenology in detail. Phenomenology says it's a philosophical approach. When we are saying philosophy, it doesn't mean that it is like a novel or anything. It is like vision of any person, what they have actually felt. That is philosophy here, right? And this is all natural. Nobody is behaving artificially. So phenomenology is a philosophical approach that focus on the study of subjective experience. Always we have to remember, whenever we are saying about qualitative research, it is always about subjective experience. There are no numerical or data collection or analysis. It will be subjective experiences and consciousness. That means inner feeling, deep feeling felt during that particular event. So that will be considered as phenomenology. Next slide, please. Types of phenomenology. We can we can understood phenomenology in three forms. Firstly, descriptive, which says who has done, why it has been done with me. Patient will say like this, how this phenomena happened, or how this particular disease happened. We will ask such question, what, why, where, 5 Ws and 1 H type of questions we will ask. We will ask many types of inquiry in the form of question and descriptive phenomenology. In interpretative phenomenology, we already know something has happened to the particular client, but now we want to interpret it. Now we want to find out that particular phenomena in a theme form. The next most important, which nowadays many authors they are using, many researchers they are working on that, the parsec phenomenological hermeneutic method. It is very good method. In this, what we are doing, single term will be explored through structured interview to have a deep meaning about that, and uh, we will have a minute experience. Even we will count. Say again, I will say chronic pain. For us, chronic pain may be very intense pain, but for him or for one patient, it can be chronic pain related to particular system. Okay, but pain is also due to anxiety related to his family. Pain was that much, it was started like this and it progressed like this. So even minute information will be collected here. So hermeneutic, it works a lot. We'll discuss it further. Next slide, please. Descriptive phenomenology, as you can see, it is concerned with the study of phenomena as they are experienced by the individual. So we will ask how you are feeling about this particular phenomena, what actually you have felt at that particular day when this disease happened to you, why you are thinking so that you are unable to recover from this, or why you are able to recover, depend upon our research question, what research question we are going to study. So what, when, how, who has helped you, why you think that he has helped you and nobody else is helping you. So we'll ask many things. We will explore the mind of the patient, we will explore the mind of our subjects so that we can understand the real experience behind that particular phenomenon. It seeks to uncover the essential structure and characteristic of live experiences. Live experiences, that means still that particular subject or patient is in that particular problem. Say somebody is having cancer, still he is having cancer and we are collecting data. So live experiences will be collected through subjective interviews Some questions are there maybe. Sir, should we take question later on or right now only?
We will take the questions after the
After session. Okay, sir. So what we have to understand is when we are describing that particular phenomena, we will describe all the W's, one H we will describe, and then particular theory we will make in the form of themes. Next slide, please. Next slide, please. Next is interpretative phenomenology. Interpretative phenomenology say, as the name indicates, it is interpretation. Interpretation is what? Phenomena has already happened. Now we have to analyze using our wisdom, using our sixth sense. Whenever we are conducting qualitative research, important thing is our sixth sense should be there, but we will not write that particular feeling of our own in that collected data, but we will collect data using our sixth sense, that is our intuition. So it is to enter into the other's world and discover practical wisdom, possibility, and understanding found in that particular world. Unlike descriptive phenomenology, interpretative phenomenology is not only collecting data through participant, but also go beyond that in connecting that data with real world example which is available around us. For example, hermeneutic circle. This can be understood as when we are collecting data, patient will tell us during, say we are collecting data from a cancer patient, and patient is saying during this particular problem, particular NGO has helped me a lot. Now, interpretative phenomenology, what they will do? They will not only collect data related to that particular patient and related to hospital only. Now, the researcher will ask question and he will interpret it. When NGO has helped this cancer patient, what actually NGO has given to this patient which hospital was not able to give. So he may go to the particular NGO and he will ask how they are working to cancer patients. So they will tell we are making online support for them, or we are providing counseling to them, or so we will try to understand what everything is helping to our patient, or what everything is causing pain to our patient, that all circle of helping or disturbance we will collect, and then we will write in analysis or how that particular experience has gone better. So all the circles we will find out in interpretative phenomenology. Next slide, please. Next important is the per se phenomenological. It is very interesting one. In this, what actually happened? According to this approach, it was recently developed by Rosemary 2014. She has written good nursing research book also. According to her, whenever we are collecting data from our client, from our subject, from our patient, it is not only interview. According to her, it is a dialogic engagement. That means client will say and we will write in a story form, not only in experience form. Storytelling will be there. Then next step will be extraction and synthesis. This extraction and synthesis will start the particular story introduction. Then what happened in between? Who were the characters in the story? Say this was my patient, and these were the caregiver, doctor, nurse, and other one, and these were the family supporter. So every character will be done in that particular story. Extraction and synthesis. And at last, there will be heuristic interpretation. Metamorphically, emerging themes will come out. Say, pain, intense, deep, it was not actually felt, or what was there. So very deep feeling will come out when we will collect data or when we will conduct research in this form. Firstly, that means Interview should be in dialogic engagement. We are talking with each other. Then extraction and synthesis. There are many steps in extraction and synthesis in storytelling. Already I have told you character building. Then in between story will be there, and at last what happened in that story. Heuristic interpretation. What actually is the conclusion of this particular research? Which character was important? Say our patient was important. Who has helped them in recovery? This person has helped them in recovery. Now how the recovery has happened, the terms will be explained in a very deep manner. So that particular heuristic interpretation is involved in this particular research, which is known as passive phenomenological method. Next slide, please. Role of intuition and description collection for descriptive phenomenological research. When we are talking about any phenomenological research or any qualitative research, always intuition matter a lot, because hypothesis is not for us. We are just collecting data, or we have started research on the basis of pain which is felt by a researcher to the patient, or on the basis of problem which is felt by a researcher towards their subject. So role of intuition and description matters a lot in doing any qualitative research, but in description it matters more than others. So data collection in phenomenology involves use of intuition, description, which, when, why, when, where, how. So this process matter a lot in descriptive. So intuition and description matters a lot. Next slide, please. Let's take one example. Understanding can be understood using this particular experience of individual with chronic pain. Researcher can use open-ended interview. Interview will not be structured or not semi-structured. Focus development group key we can make. There is no issue. But open-ended interview will be there. Rich description of individual experience. We will collect thought. We will collect feeling. We will see what sensation they are telling us, and we will write about pain, and we will write. In doing qualitative research, it matters a lot. If patient is saying pain, we will write pain. If patient is saying dard, we will write dard. If patient is saying pida, we will write pida. So according to that, different terms we will use, and we will finally reach to the different meaning of a single term. These different meaning will help you in development of theory later on, which is basically grounded theory. We'll understand later. Next slide, please. Example 2 is exploring the perception of body image. Phenomenology can be used to explore how individuals perceive their own body image. It is very easy to say somebody is beautiful, somebody is not beautiful, somebody is fat, somebody is thin, like that. It is very easy. But what are the in-depth experiences? That also we can find out. So what actually making somebody happy about their body image, and what actually things are there which is not making them happy about their body image. How we can find that? Through in-depth interview, subjective feelings we can find out how they are feeling about their experience, appearances, what they like to wear, what they don't like to wear, how they feel when somebody appreciate you. Especially such studies are done in elderly patient and palliative care patients. Next slide, please. Importance of phenomenology in nursing research. The finding obtained through phenomenological research in nursing can have significant implication for clinical practices, nursing education, and health policy development. We can gain a deep understanding of patient experience. Nurse can tailor their care, can improve their care process to meet individual need and preferences. It also enables healthcare professionals to develop a more empathetic, because we have heard a lot feeling about our patient, no. So we can be more empathetic toward our patient. We can provide patient-centered approach. We can have better communication because we have understood their experiences, and we can develop trust between our patient and healthcare provider. So trust building can be there, better communication can be there, and more empathetic, means soft communication skills can be enhanced by qualitative research also. Caring attitude can be enhanced by phenomenological research. Next slide, please. Next important one is grounded theory. It is somewhat scientific. Everything is there. Many researchers they have collected, but it is grounded. छुपा हुआ है, ground में है. So grounded theory is a qualitative research methodology that aims to develop a theory based on the data collected from the research participant. Here we should note that there will be development of theory. Previously we didn't say that phenomenology will help in development of theory. But in grounded theory, we are saying it will help in development of theory. That is the basic point. In both the types, we are collecting data. In phenomenology also, we will collect experience. In grounded also, we will collect experiences. But experiences in grounded theory will be collected to make concept, and from concept, we will develop theory. In nursing and healthcare settings, grounded theory can be used to explore the experience of patient, caregiver, healthcare provider, convert it into concept, then develop a theory, and that explain the experiences. Say health belief model, health promotion model, all the middle range theories, all the new theories which are developed, they are basically the example of grounded theory. We will see it now. Next slide, please. The basic meaning of grounded theory is grounded theory will help in production of concept, and these concepts will help in generation of middle range theory. As everybody know that there are grand theories, right? But after grand theory, what came? It is middle range theory. So middle range theory, how we are developing? Middle range theories are developed from concepts, and these concepts, from where it is coming? These concepts are coming from the interviews, and these interviews we will collect in grounded theory. Next slide, please. When we are conducting grounded theory research, what we have to assume? This is very much important because if our mind is not set up as a qualitative researcher, we can never perform qualitative research because we become empathetic with the subject and we will write what we are feeling. We will not write what actually patient is saying. So what we have to assume is human being alone is nothing. Their behavior is everything which is making them so we have to focus on the behavior, why they are behaving so, not on the human. ये इंसान अच्छा है, ये इंसान बुरा है. We will not say like that. We will say this particular behavior is shown under this particular situation, and the reason which he has told was this. Then we will develop a concept. This was the concept why this particular behavior was shown. So this concept will make a category, and category will lead to development of theory rather than saying this human is like that. Next slide, please. Stages of grounded theory. Firstly, when we are collecting data, we have to basically code the data. We have to compare these type of concepts, these type of data is with us. We have to code that. Then we have to categorize in the sense there will be concept, sub-concept, categories and subcategories. So, and then last is theorizing. In theorizing, what we will do, it is also known as theoretical sampling. Theoretical sampling will be particular researcher in grand theory, they have said so. Now in my research it is same match, it is in the same way, but my theory is the modified form of that particular research work. So I am modifying the previous research work through this particular grounded theory. Let's see it further. Next slide, please. Challenges. Firstly, we will understand there is lack of understanding and knowledge about the methodology among researcher and stakeholder. There is difficulty in applying the methodology in complex and dynamic healthcare environment. Our environment many times don't allow us to do such type of research. potential for researcher bias and subjectivity in data analysis and interpretation. Qualitative research takes time, too much time. It needs too much ethical consideration. It takes too much subjective experiences, knowledge. So there are many biases and interpretation. What patient is saying, what we want, what actually is required in health policy, it need a lot of critical think work. So that interpretation matter a lot. So data analysis part is really, really important to practice in qualitative research. Next slide, please. Benefits in grounded theory. There is no harm in doing grounded theory. There are benefits only. So grounded theory is powerful research approach that help nurses to generate new theories. Everybody want to say no, we want to be researcher. So those who want to be researcher, at least theory they can develop in life once. That means they are really researcher whom people will know. So nowadays many people they are making situation specific theory according to different situation how people are managing themselves. So such situation specific theories are coming from grounded theory. These theories are helping nurses to generate situation specific theory. We are not only developed we are not only dependent on grand theory or middle range only. Now we are developing our own situation specific theory. By analyzing grounded theory, we can uncover hidden pattern and relationship that might otherwise go unnoticed. Something which was very important, but we didn't see that there is relationship between this, and we can make a theory. What is positive in this particular behavior, and what was the negative thing that make this behavior happen, that positive and negative and this particular behavior, that is basically theoretical concept which we can make. One of the key benefit of the grounded theory is its focus on inductive reasoning. Everything is given by subject and our intuition, and we have induced that particular feeling in our theory. So we have induced, we have searched, we have discovered. So that's why this will add on knowledge of nurses, and this will add on knowledge of nursing research, and we can make new ideas and we can make new hypotheses. This approach allow us for more open and exploratory research process which can lead to new and innovating findings. Next slide, please. One case study, patient experience in hospital. In this study, everybody know there are different type of experience of patient, but why we want to explore? Because we are qualitative researcher and we want to make patient experience very good. So what we can do? We have to understand in depth what actually patient is experiencing when they are in hospital. So in this study, researcher aimed to develop a grounded theory of patient experience in hospital setting with a focus on the factor that influence patient satisfaction and outcome. That means when patient is feeling positive, there will be positive outcome, and when patient is feeling negative, outcome will decrease or increase, whatever it is. So we want to see that what are positive things and what are negative things. To achieve this, researcher conducted semi-structured interview. Already question was set with the patient, family members, and healthcare provider in a large urban hospital. They use open coding to identify themes and the concept themes and concept. That means they have developed grounded theory. So data they have collected and constantly they are comparing. When constantly we are comparing, coding we are doing, that means coding is also there. So category will be there, subcategory will be there, and coding and categorizing. Firstly coding, then categorizing. Coding and axial coding, categorizing and subcategorizing. It will go step by step. So like this they have done. And finally we will reach up to the concept. The researcher found that patient experience was influenced by several factors. We are simply saying that patient will enter in the hospital and they will admit it and will went out. No, there are several factors. The important factor were communication with healthcare providers, access to the information, where they will go, how they will go, who will take them, whether they will do or whether nurse will do, who will collect sample, when they will come, many information is there. So access to information and resources, and the physical environment of the hospital, how it is, how they are feeling in that particular environment. So they also identified several sub-themes with these categories, such as in communication, they have find out importance of empathy and respect. Nowadays we use this research is already this was action research, and now everybody is following these researches, and we never know why communication is very much important in hospital setting. This particular thing which we are following in our behavior, in our code of ethics, these are the result of these particular research work only. Empathy we are showing with our patient, respect we are giving in communication because they have find out, and the impact of noise, lack of privacy on patient comfort and recovery, they have found these things. So hospital, they will take care of these things, so outcome will be better. So they have done interview, they have found these problem, and what they actually want these things, and these particular concept, if we will improve, our health outcome will be better. So overall, the study highlight the value of grounded theory in nursing research, particularly in generating rich and nuanced understanding, minute understanding of complex phenomena such as patient experience. Next slide, please. Next slide. Data collection. Grounded theory, when we are saying we will develop concept, we will do coding, we will develop concept, we will analyze the data, right? Everything we will do. So in grounded theory, every time it is not open-ended question. There are semi-structured interview, there are observation, and every time we have to find data in such a way that it will lead to development of concept, because you are yourself a tool were not formulated properly. So data collection is really important. Cancer is same, renal cancer or abdominal cancer or colon cancer, everything cancer, particular symptoms are same, but the feeling related to particular symptoms are different. That particular feeling, how we will collect, that is the basically task of qualitative researcher. So it is not like that simply we will see these are the symptoms, okay, we will write pain and bleeding and other things. So we have to see what is different in different patient, and different thing we will collect through the interview or through observation or through semi-structured interview. Phenomenology involves data collection through in-depth interviews also, with a focus on exploring the subjective experiences of individuals. Next slide, please. Data analysis. We are comparing grounded theory and phenomenology. When we are focusing on experience, we will gain insight of experience. But when we have gained, now we move to next step. That is the better step. That is the bigger one. Next step. That is grounded theory. Already concepts are there. These concepts need to be relationalized. These concepts need to be seen in parameters of positive and negative influence, and that will be data analysis in grounded theory. So grounded theory, what we can say, pattern and themes will generate it, and that will lead to theory, whereas in will focus only on themes and meanings. Next slide, please. Interpretation. Grounded theory, how it is different from phenomenology. Grounded theory interpretate a theory that is grounded in the data with a focus on generating new insight and theories. Already data was there, but we haven't developed that particular theory. But phenomenology, the subjective experiences was embedded in the particular patient, and we have to find out in the form of themes. Next slide, please. In conclusion, we can say grounded theory is a valuable approach for nursing research that allows for discovery of new theories and insight into a complex phenomena. and insight into the complex phenomena by using inductive approach, because qualitative research is using inductive reasoning. So inductive approach and focusing on data analysis, researcher can gain a deep understanding of their subject matter, and they can develop theory that are grounded in empirical evidences. Next slide, please. Let's see a classical example. What actually we were talking, we will understand through this example. In this example, Harbour et al., they have developed a qualitative research. They have conducted a qualitative research, and this model was developed by them. This model is basically what, when a person is feeling that he is having heart failure or not, basically heart pain, chest pain, he is feeling, what he will do, why he will do, and why he will do, the factors behind that. So person's self-efficacy, patient's disease concept of heart failure, from where it is coming, there are many negative things and there are many positive things. Negative say some negative emotions of the patient may affect self-efficacy. Negative attitude may affect self-efficacy, and negative belief may affect self-efficacy. That means managing their own condition, their knowledge, their attitude, their practice, basically that is self efficacy. हम खुद से अपना काम कितने अच्छे से कर पाते हैं, that is self efficacy. हमारी उसकी पर्टिकुलर नॉलेज, किसी भी पर्टिकुलर इवेंट को मैनेज करने की नॉलेज क्या है, हमारा एटीट्यूड कैसा है, हमारी प्रैक्टिस कैसी है. So negative things are these, but there are certain positive personal characteristics which can enhance their self efficacy. Their ethnic socialization, that can be positive or negative. Cultural belief, they may have positive or negative influence on self-efficacy. At all, if we will see how self-efficacy is affected, knowledge, attitude, and practice, by negative emotion, attitude, belief, by personal characteristic, by cultural belief, and by ethical solution. So they can be positive or sometimes they can be negative, but they will determine self-efficacy. Another factor are uncertainty. We are not sure what to do in particular condition. Incomplete knowledge. Incomplete knowledge will decrease the self-efficacy, but increased knowledge is a positive factor. So plus it is written. Past experience and action, sense of control and commitment. This will enhance the self-efficacy, and patient disease concept of heart failure can be improved. So in any situation, natural situation means it can happen to anyone at any time, because qualitative research is like that. So in any natural situation, they will able to take decision. When they will able to take decision, along with health professional also, if they are helping, in a healthcare system also, if they are helping, if there are financial constraint, they will not be able to take decision because it is written negative, right? If there are language barrier, they will not be able to take decision, it is written negative. If there is family support, it can help them in taking decision, but if there is no family support, they may take decision or they may not take decision. If comorbidities are there, other diseases are there, they may not be able to take decision. Adverse effect of self-care is there, already some diseases are there, so they may be having negative effect. So what can be the positive influence and how negative influences can be overcome? It was mentioned in the particular model, and the effective self-care, how they can achieve, and effective self-care will lead to self-efficacy of the patient. These particular model, which is explained by Harbour, these are known as situation-specific model, and these particular model are basically generated by our grant but particularly we are saying any grand theory is there, we can modify grand theory of say self-care is there. Now they have using this grand theory of self-care, they have developed self-efficacy situation theory using grounded theory approach. So grand theory is modified to the situation specific theory. We are not using Orum's theory or another theory, we are using our own theory, we are generating our own research work. So on the basis of grounded theory approach, we can generate this kind of research work for different situations. So this is all about qualitative research for phenomenology and grounded. If there is any question we can talk about. Thank you so much for your patience listening.
Thank you very much, ma'am.
Thank you so much.
We have a raise hand for few persons. I think they have some doubt. That one is the Amandeep. Amandeep, ma'am, you are here. Amandeep Barar, ma'am. Is there any questions? If any
sir.
audience have no, Sanjay Soni sir, Mr. Sanjay Soni, Mr. Sumit. And ma'am, the session was really very informative,
Thank you,
and
sir. My pleasure.
the way you have explained the things in a very easy manner, it was really helpful for the specifically for the newcomers who have joined us, or even though the person who are interested to be involved in the qualitative research, it will really helpful for them to understand the basic phenomena of the qualitative research. And really, we are very thankful, ma'am, for you for sharing this knowledge with us.
Thank you for your support, sir.
Thank you very much. And if any question is there, kindly you have a open platform. Yes, Varsha, ma'am, you are having a hand raise. If you have any question with the ma'am, you can ask them. I think no questions from the. I think either two things will be there. Either they understood everything, or they have not understood anything. Yes, Mr. Raj Budania, you can ask.
In research setting.
Ma'am, can you repeat hermeneutics research?
Yes, sir. It is understanding the social circle also. Why this particular phenomena is happening and what is the factor behind that. See, I'm saying I'm feeling sick, right? But whether somebody has proved that uh, when somebody is sick or when somebody is not feeling well, they will feel depressed. कभी किसी ने prove किया क्या? So what we have to see, when we are using hermeneutic approach, we will see where it is written when somebody is sick, they will feel low. It may be written anywhere. It may be written in any literature, basically text analysis. Say we will see in one book, medical book of internal medicine, it is written when somebody is sick, they will feel depressed, they will feel low. So this is hermeneutic approach. We'll find out the evidence which is present anywhere, basically the text related to the statement which is expressed by the patient. So we have to correlate and mention that it is also expressed by this particular literature. So textual analysis also we have to do in hermeneutic. Also, not only textual, we can find out some, it is written on some wall, we are feeling so. It is written some thoughts somewhere. In dictionaries, it is also matter. So anything which is supporting our patient feeling, we can find out and we can correlate. Am I clear, sir?
Yes, ma'am. Clear. Thank you. Thank you so much. Thank you, Virendra sir. It's really
You're
very
welcome.
interesting topic. Actually,
Thank you very much. Any other participant who have any doubt, they can ask. Or we can close the session. Okay, thank you very much, ma'am, to join us, and all the participants for joining us on these events. And tomorrow again, we will be live on the Google Meet as well as on the YouTube also. And the link will be shared 15 minutes before on the group. Thank you very much once again, everyone.